When I am in pain, I get stoic. When I feel...
So if you can, go back and watch this creator's video. She made some really great valid points as far as pain perception. But the little 5-second soundbite is what I wanted to talk about because it triggered me to talk about this article that I read below. And it's titled, Black Patients Adjust Behavior to Reduce Their Chance of Discrimination in Healthcare Settings. And I'm going to talk about that survey. So in this 2022 survey, what they did was they took Black Californians and they talked about what were some of the strategies that they used in order to be taken seriously, in the healthcare setting. And according to some of the stats, 32% of African American Californians pay attention to how they dress before they go into a healthcare setting. They modify their speech and or behaviors to put the doctors at ease. And then 41% of the patients signal to the provider, letting them know that they're competent, and researching their maybe conditions or their illnesses before going in to let that provider know that they're educated, knowledgeable, and prepared before going into the visit. So here are just a few stats. And again, these are just some strategies that Black Californians reported using to increase their chances of being treated with respect. Again, a lot of them researched their health condition or concern before meeting with their actual provider. A lot of them signaled that they were educated, knowledgeable, or prepared before going into the doctor. They tailored their speech and or behavior to put the provider at ease and to avoid being off-putting. They also took a companion into the exam room during an appointment to kind of serve as an advocate. A lot of them, or a third of them, paid attention to how they were dressed. And then some folks, unfortunately, would minimize their questions and concerns to avoid being perceived as difficult. So this passage here just comes from a 24-year-old Black mother, and she says that these are some of the steps that she deliberately takes in order to mitigate those negative healthcare experiences. She says that I feel people judge appearances, so I always make sure my kids are in nice, neat clothes, something appropriate for the doctor. I always make sure I give them a bath before the doctor so they can look their very best. She goes on to say that she makes sure she takes care of their teeth hygiene. And she does this, again, to not be treated unfairly and to prevent people from looking at her kids sideways. She also goes to say that she brings all of their Social Security cards, doctor cards, and things like that. She says that she does this because she wants to protect herself and she doesn't want to be judged and made to feel uncomfortable. So I bring up this article to just bring awareness to providers who take care of African American patients that we are doing all of these behaviors behind the scenes and we're sick and we're not feeling our best and we have chronic conditions and we may have mental health and we may be in extreme pain. So I bring this awareness to providers that, again, these things are going on. These things are on our minds because we do not want to be discriminated against, and we want to be taken seriously when we are sitting in front of you as a patient.